Dementia, or the severe loss of memory, language, and other thinking skills, it's most commonly caused by Alzheimer's, which affects about 120,000 people in Wisconsin, according to state health officials. Local doctors say a therapy you may not think of, speech therapy, may help. Armand Rahman in the News Center tonight to explain. Armand?
Eric, speech-language pathologists at SSM Health say there are exercises dementia patients can practice to express themselves as fluently as possible without getting frustrated.
That's a hose, because we just did that up north.
Harry Stein is looking at pictures of household items and describing what they look like, where he'd find them, and how they're used, a strategy to improve his memory.
How to sit and talk to people so they didn't know I was disguising this memory loss. So I can enter into a conversation with people.
Sarah Simon is the speech-language pathologist who started working with Harry around 2019, when he and his wife say dementia
It's very bothersome.
really started affecting how the retired attorney functioned every day.
I will walk out of here and I won't remember your name. I've just lost the ability to come up with the names of the streets. And that's very troubling.
That's exactly where Simon says she's seen speech therapy help.
So trying to maintain the person's level of function and prevent further decline, which is really important to allow people with dementia to engage in meaningful activities for them.
Shave down and then under the...
Perfect. That's perfect. So then I would say, Harry, are you talking about a razor?
What she's doing with Harry is called a compensatory word strategy.
Can they picture what they're trying to think of? Can they gesture it or act it out? Can they describe it? Because those are giving cues to the listener, but also helping the person with dementia try to communicate as independently as possible.
And Harry says he's already seeing improvement.
I remember best when Sarah said, "Here, just talk around it. Talk around it. The person you're talking to will come up with the word for you." And it is true.
And Simon says other strategies families and caregivers can use to help while also maximizing the patient's independence are external memory aids like calendars, daily planners, and alarms.